Hi, I'm Dr. Joe Capella, and my practice focuses on body contouring after weight loss. Since I finished my training in plastic surgery at the Mayo Clinic over 25 years ago, I've had the privilege of caring for more than 25,000 patients who've gone through major weight loss. I grew up watching my father, who's a pioneer in bariatric surgery. I saw him change people's lives by helping them lose weight, but I knew they weren't completely happy. They were still trapped in their old bodies, and plastic surgery was a way to transform them into their new bodies and their new lives. My patients have already done the hard work. They've lost a significant amount of weight through surgery, medications like GLPs, or lifestyle changes. They feel healthy. Their numbers look better, but when they look in the mirror or put on a bathing suit, they still don't feel like themselves. They're covering up, avoiding trips, skipping the beach or the pool, and holding back in social or intimate situations. My work is about completing that transformation so your outside finally matches that strong, accomplished person you already are on the inside.
So Dr. Capella, what's your favorite procedure?
My favorite procedure, hands down, is a body lift. It's so much more than a tummy tuck. It addresses the front, the hips, the thighs, and the buttocks, even the inner thighs, all in one procedure in 3 hours. I can't say enough good things about this procedure, and my patients wish they had done it sooner.
That sounds like an incredible procedure. I can only imagine how the patients must feel after such an experience.
Totally. It's such a boost to their self-confidence. For the first time, patients tell me that they can go to the beach or go to a pool in a bathing suit and not have to be covered in clothing during warm weather. And during intimate situations, they feel so much more empowered. It's a game changer in their lives.
Although it seems like a lot of surgery, what's the recovery time like?
Believe it or not, I prefer that my patients are up and about walking. I don't want them in bed or sitting in a chair. I prefer that they get back to work as soon as they feel like they're able to.
The procedure sounds amazing. How do you assess someone to see if they're a good candidate for it?
Interestingly, I do the same thing for virtually every person that comes to my office considering this operation. I stand them in front of a mirror and I have them with their hands pull up very firmly in the stomach area, and I lift in the hips, thighs, and buttocks. And they see right there what the transformation is in their thighs, and so do I. And if there's a significant transformation, they may then be a good candidate for the operation.
This is fascinating. So where does the scar actually go when you do a procedure like this?
The scar in the front is low, similar to where a C-section scar is, and then it goes up a little bit and follows the same path as where a bikini. So the idea is so you can hide it with a small bathing suit.
So can you see the scar, or what does the scar look like?
So the scars are initially red, like from all surgeries, and then gradually fade over time. And most people's scars between about a year and 18 months become their own skin color.
So these weight loss drugs like GLP-1s are becoming so popular. Are you seeing more patients coming to you as a result of those drugs?
Absolutely. I would say that the majority of my patients are taking those medications. Even patients who had bariatric surgery in the past are taking these medications. It's really changed everything. The weight of my patients is much lower and better suited for good results than it had been in the past.
So what is another procedure that patients find is life-changing?
When people lose weight, especially women, they're often most concerned about their arms, even more so than their bodies. People like golfers, hairdressers, and teachers. And so they come to me often saying, this is what I want addressed first, because it's hard for me to hide that area.
So the scar seems like it would just be visible for this procedure. Like, where is it placed or hidden? How does that work?
The placement of the scar in an arm lift is critical. And the ideal placement is on the lower part of the inside of the arm. The scar is not visible from the front, the side, or the back. Just how tailors put the seam there, they've been doing it for hundreds of years. They know what they're doing.
So now shifting gears a little bit, what would be one of the procedures that is not as common, but extremely powerful for the patients that you see?
That's a great question. One of the ones is an upper body lift, something that I do practically on a daily basis. Most patients are told they need a breast lift and an arm lift, but they forget that area to the side of the breast, which patients often call the side boob. That's an essential part of addressing the upper body of a woman and a man too, to some degree. So an upper body lift in my practice is a breast lift, addressing that area to the side of the breast, armpit, and the arm, all in one 4-hour procedure.
So the upper body lift, that sounds amazing. is there ever a time that you can do a upper body lift with a body lift? Does that ever happen in your practice?
Absolutely. In the right candidates, I will perform a body lift and an upper body lift. And for some patients, they're completely done with their body contour concerns after weight loss. It would be an honor to be part of your transformative journey. Please reach out to our office if you have any questions.